welcome to this video podcast update for businesses in the Lancaster district area. Hi, my name is Steve Sylvester. I'm one of the managers in the Environmental Health Service here at Lancaster. I look after food safety, licensing and health and safety. So hopefully, as a local business, you will have had an opportunity to check out the information that we have available on our website, helping businesses understand how they can manage under the current COVID-19 pandemic and how that would affect local businesses. We've had quite a lot of positive feedback from people who have accessed the site and found some useful information in there. And we've got a regularly updated questions and answers page, which hopefully you'll find useful. So if you haven't already checked it out, I could certainly encourage you to check out our website, which is www.lancaster.gov.uk, and then you'll see on the front page a link to the general advice on the COVID-19. You'll also find there the slides and presentations from the virtual food forum that we published last week. So hopefully you'll find some useful information from there. So in addition to the updates that we post on our website, we thought it would be useful to provide a very short, focused, video-based podcast for businesses. And this is the first of those, which we will be providing on a regular updated basis every so often, as we feel that it's appropriate. So today, what I want to cover is health and safety. So for businesses that are already operating and open, then you will have already thought about social distancing, protecting your staff, protecting customers, protecting yourself. But if you're a business that hasn't yet opened or may not be permitted to open just yet, this is still a good time to be thinking about health and safety for that point where you do reopen, because it does look like that the COVID virus is going to be with us for quite some time. So we can imagine that some of the controls that we're already seeing in the public areas will have to be in place for quite some time to come. So purpose of the video today is to try and keep some of this as simple as possible. Realize that government legislation can be quite complicated. It's not always that clear on how to interpret what it really means in practice. So I'm trying to kind of bring it down to fairly basic level so that everybody can understand some of the checks and balances that you need to have in place. So what I'll be doing is covering a number of areas in this presentation. Your legal obligations as a business operator, what it really means in practice, and that's really important to everybody, and some basic steps that you would need to think about. Well, whether you are a new business that's about to open, whether you're an existing business that's already open, health and safety risk assessments as things that you need to be thinking about. And there is now a specific one for COVID-19 to take into account. And I'll also touch on some of the more general business advice and support that Lancaster City Council is providing to its local businesses. So hopefully that will be something that you will find useful. But do remember, keep everything under review. The situation does change, not quite daily, but it is changing. And you do need to keep an eye on the council's website for news updates, keep an eye on the government's website, Public Health England, and of course keep an eye on the media as well, because they do give some useful information which gives you the heads up that things may be changing. So I'll now just move on to what we want to cover today, and I hope you'll find it useful. But if there is anything that you want clarity on, if you've got any further questions, but please do not hesitate to get in contact with the Environmental Health Service here at Lancaster. So what do you need to do as the business operator carrying out a risk assessment? Well, to try and demystify it, it's a fairly simple process that you need to look at your business, because the best person to be able to conduct a risk assessment is you. It's your business. You understand your business. You understand your staff. You know how things operate on a day-to-day basis. So really, the best person is the person in charge of the business to carry out that risk assessment. Now, there are templates to help you focus some of the suggesting some of the questions that you would want to be asking, and we'll put that resource on our website. And also, there is information that you can pick up from the Health and Safety Executive, and we will put the links on the website as well that may help you. But try to remember, keep it simple, don't overcomplicate it, and also involve your staff. They need to be part of this process. So talk to your staff about how to manage the risk, and also remind your staff it's really important. Social distancing is really important. Hand washing is really important. These are all things that they need to be aware of. So follow a fairly standard, straightforward process. Look at your business. Who's coming into your business? Have you got customers coming in? Where are they paying? How are they going to walk around the shop? Where are your staff going to be? Can you maintain the 2 meter social distancing for your staff? If you can't, what are you going to do about that? Are you going to reduce the number of staff? Are you going to have staff coming in at different times, different start times, different finish times, just so that you minimize the number of staff in at any one time? These are all things that you can be thinking about that will help to control the risk. And as I said earlier as well, if you're a small business with a small premises and you can't maintain that social distancing of 2 meters all the time, then the use of face coverings may still be an option for you. But remember, if you've got 5 or more staff, you must write this down. You must document it. And as I say, there are templates on the website that you will find helpful to help you do this. So try to keep it simple, document it, don't overcomplicate it, and I say, just remember, infection control is something that we talked about before. It's not an alien virus. It's a response to the same controls that any other virus would respond to. But if you're thinking about the disinfectants that you're using, please remember, follow the instructions. Remember about the contact time to make them effective. So what does it actually mean in practice? At the end of the day, it doesn't necessarily have to be really complicated. It's not something that we need to be employing expensive consultants to carry out. It is a straightforward process, and as I said earlier, we are dealing with a virus, so which responds to the usual infection control measures that we would normally use. So it isn't out of the ordinary as far as the checks and controls that you need to be considering. Some of these, of course, you'll already be familiar with. Social distancing, washing your hands more regularly, the use of hand sanitizers. These are all things that you would need to take into account when you're considering reopening your business. Or if you're already open your business, hopefully you've already considered these. The difference now is that if you have 5 or more members of staff, of course you need to document it. So don't forget that. So I've already mentioned some of the checks and controls that you need to think about. Social distancing is the obvious one. Now, we do get quite regular questions from businesses about, well, how do I actually manage social distancing within my staff? Well, actually, in theory, dealing with your staff should be a lot more straightforward and easy than actually dealing with customers coming into your business. At the end of the day, if you're a shop, you may be dealing with hundreds of customers coming into your shop every day, and you have no direct control over how they're going to behave. You would like to think most people will use common sense, but that's not necessarily going to be the case. Whereas with your staff, you already know your staff. So hopefully you've got more control over how your staff behave in that situation. And therefore it's a lot easier to control the risks with your own staff than it is with the customers. So therefore you need to be thinking about what checks and controls do you put in place specifically for customers. And I'm sure as everybody is going out and still doing shopping, going into shops, then you'll have noticed that many businesses have marked out one-way systems. They've marked out lines where people are supposed to stand, barriers, physical barriers, maybe in some cases where at the checkout we've got plexiglass type screens that are now being put in place. These are all controls which are straightforward. Some of them may be costly, of course, if you're putting screens up, but they are fairly straightforward controls that you should be thinking about. Having a one-way system within a shop is a very good idea. The only thing is you have to remember that whilst, again, most customers you would hope will follow the rules, you do need to keep a check to make sure that you do have an eye on how the customers are behaving. And if you do see somebody that is really not behaving in the way that you would want them to behave, you do need to challenge them in a polite way, of course, but they do need reminding that this is about protecting their safety as well as your own staff safety. So you need to bring it to their attention. So once you've completed your risk assessment and you're satisfied that you have thought about all the different aspects of your business where your customers might be at risk, that your staff might be at risk, your delivery people might be at risk, either that's people that are coming to pick up deliveries to take them away to customers, or whether it's food deliveries coming to your premises. Once you've considered all of those aspects and you're satisfied that you've done everything that could be expected to control the risk, then you need to print off the COVID-19 compliance poster, which is available from the Health and Safety Executive's website. And again, we'll put the link on Lancaster City Council's website. Print that off and then display that somewhere within your business. But remember, you need to keep this under review. So if there is a change in circumstances, if you start having more customers coming in, or if you expand your business in some way, then you need to reflect that in your risk assessment. And if you've got more than 5 or more staff, remember you need to document the changes that you've made. You may also have seen people walking around wearing masks. Some people coming into your shop, your business, wearing masks, or maybe you're wearing a mask. There has been a lot of uncertainty about whether we should or shouldn't be wearing masks. You also may have noticed that there has been a change in the term about masks, and this move towards the term face coverings. And I think this is a deliberate attempt from government to point out that there is a distinction between what you'd consider to be a full face mask, which you'd expect somebody to be wearing in a clinical environment, in a hospital, for instance, or a much more basic covering or face mask. So I think that's why they've now introduced this term face covering, as opposed to referring to face masks. Now, the government's position still on this is that it's not obligatory, it's not mandatory that you should be wearing a mask. And I think the science is still uncertain about the benefits of wearing face coverings or face masks. If you're going to wear a face covering, something fairly basic, and there are lots of DIY versions out there on the internet with instructions on how to make face coverings out of material that you'll find around the house. And I think the general consensus is that by putting on a face covering or a basic type of face mask, is actually more about helping to stop you from spreading the virus, should it be that you actually have it but don't know you have it. Because we also know from this organism that it can take a while before you show the symptoms, but in the early stages, you can still be passing it on to other people. So, by wearing a face covering, even if it's a fairly basic homemade face covering, then it can help to reduce the spread from you to others. So you're less likely to be sneezing or coughing and spreading it in that way. But I think where there is less scientific evidence is whether it's actually going to protect yourself from picking it up. So it's a choice. Nobody's forcing anybody to wear face coverings, so it is down to a choice. And I think it's too early to say one way or the other whether it's a good thing or a bad thing. But a question that we do get asked quite frequently is, if you're operating a kitchen, for instance, takeaway or food business where your kitchen is really quite small, you cannot manage the risk through social distancing. Whilst we would say keep people apart by 2 meters, it isn't always that easy to do so in such a small environment. So our advice there is, well, if that can't be done, then the answer is, of course, encourage people to wash their hands more regularly. Please make sure that you ask your staff to give you an early warning that they may not be feeling very well. So do regularly check in with your staff. But the use of face coverings is another way of helping to reduce the risk. So I think in that sort of situation, then we would accept that as a way of controlling the risk, just so that you can carry on trading. And of course, hand washing. We have been told so many times that's what we need to do, and that's going to make a big difference in controlling this virus, and it's absolutely true. Hand washing, trying to avoid touching your face, these are all, again, common sense, straightforward things, but are really important in infection control. So do make sure you get that message across to your staff that they do need to be washing their hands regularly. But you need to make sure that they have access to hand washing facilities and that they have the opportunity to wash their hands. So these are things that you need to take into account. Where is the wash hand basin going to be? Do you have soap? Do you have hot water? And do you make it accessible and make sure that your staff know that they have got the time to go off and wash their hands, and that is fine, and you would expect them to do so. You do need to monitor it, of course, because again, if you're not there all the time, you need to be making sure that your staff are actually following your instructions. So do keep an eye on the wash hand basin, the soap. Make sure it does look like it's being used, because you need to remind staff that that's really important, not only for their own safety, but of course their colleagues' safety as well, and your safety. So that's the end of the video podcast for today, focused on health and safety. I hope you find some of it useful. I've tried to keep it as straightforward as possible. We are here to help out wherever we can, so please do not hesitate to drop us an email if you want some clarity, some advice. If there is something you're just not so sure about, please ask us. And if we can't assist, well, hopefully we can direct you to somebody who might be able to provide that advice that you're looking for. So please check in again for regular updates. This is the first of our video podcasts, so we will try to do these probably on every 2 weeks is the sort of frequency that we're looking for. But if there's anything significant changes, then we will bring out another podcast, and of course we'll update our website accordingly. So good luck, keep safe, keep well, and I hope your business is doing as well as can be expected under these difficult circumstances. Take care.